How accurate is ultrasound for bladder diagnosis? Have you ever wondered how effective ultrasound is for diagnosing bladder issues? Ultrasound is a popular imaging method used to evaluate bladder health. It is non-invasive, accessible, and does not use ionizing radiation. This technique uses high-frequency sound waves to create images of the bladder and nearby structures. In bladder diagnosis, including for bladder cancer detection, ultrasound plays several important roles but also has limitations. First, ultrasound can visualize the bladder and detect bladder distension. It can measure post-void residual urine volume and identify larger masses or abnormalities within the bladder. This makes it particularly useful for an initial assessment of bladder function and structural issues. However, when it comes to detecting bladder cancer, ultrasound has its challenges. While it can identify some bladder tumors, especially larger or more advanced ones, its sensitivity and specificity are lower than other imaging methods like cystoscopy, computed tomography urography, or magnetic resonance imaging. Ultrasound may miss smaller or flat lesions, such as carcinoma in situ, which are crucial for early bladder cancer management. Therefore, ultrasound is not a definitive tool for diagnosing bladder cancer but serves as a helpful complement to cystoscopy and advanced imaging techniques. Ultrasound also aids in staging and monitoring bladder cancer. It can help evaluate the size of a tumor and its involvement with the bladder wall. However, it is limited in assessing whether cancer has spread beyond the bladder or to other organs. For accurate staging, computed tomography scans with contrast or magnetic resonance imaging provide more detailed information. While ultrasound may be used for follow-up in some cases, it is not the primary method for tracking tumor progression or recurrence. One of the significant advantages of ultrasound is its safety, cost-effectiveness, and availability. It is suitable for initial screenings or evaluating symptoms like blood in urine or urinary retention. Ultrasound can guide further diagnostic decisions, helping determine if cystoscopy or advanced imaging is necessary. Despite its benefits, ultrasound has limitations and cannot replace cystoscopy, which is the gold standard for bladder cancer diagnosis. Emerging diagnostic methods, such as urine-based molecular tests and liquid biopsies that analyze exosomal RNA markers, show promise but are still under research and not yet replacements for imaging or cystoscopy. In summary, ultrasound is a valuable tool for assessing bladder health and can detect some bladder abnormalities, including larger tumors. However, its accuracy for bladder cancer diagnosis is limited compared to cystoscopy and advanced imaging techniques. It is best used as part of a comprehensive diagnostic approach that includes clinical evaluation, urine tests, cystoscopy, and, when necessary, computed tomography or magnetic resonance imaging scans. If you have symptoms or risk factors for bladder cancer, it is essential to seek professional medical evaluation to determine the best diagnostic strategy tailored to your individual case.